That's right, National Alzheimer's Month. Now, a lot of people don't know, but it's the most common form of dementia, a general term for memory loss and other intellectual abilities serious enough to interfere with daily life. And here to tell us all about it, we have Dr. Fred Romero. Welcome. So what is the most important thing that people need to know about, Alzheimer's?
Is that it's an epidemic right now. People don't realize the proportions of U.S. citizens being affected is somewhere in the 5 million currently right now, and it's projected in the next 40 years for that number to go up to 16 million. And the unfortunate situation, probably make matters worse, is anyone who's currently afflicted with the disease, there is absolutely no cure, nothing that will stop the progression or reverse it at this moment.
So it sounds like a very serious, would we say a disease or condition?
It's a disease.
Okay.
Yeah.
It's a disease. And who are the people who are most prone or common to, become victims of Alzheimer's? Usually
age. Age is the biggest factor. Yeah.
And what about any particular group of people at risk for Alzheimer's?
It's not prejudiced at all. It just attacks everyone. It's mainly known because there's plaque formations in the brain. That's one of the gold standard things. But the important thing is, part of the lecture that I'm giving tomorrow is to get a little bit of information with regards to everything we can know about Alzheimer's.
And is there anything people can do to prevent it or to work on it?
And that's actually what the majority of my lecture will be over, is prevention, because since there is no treatment, there is actually no cure, no regression. The important thing is how to reduce your risk factors. And the number one thing, if I could sum it up in a combination of 2 words, is lifestyle changes. Lifestyle changes.
And I've heard, I don't know if this applies to this, but you can practice your memory?
Yes, you can. You practice. And actually what we're going to convey is the most important thing, rather than just exercising your brain. It's going to be a combination of making emphasis on many things, such as sleep, such as physical exercise, mental exercise, reducing your toxic or environmental load with regards to products, chemicals that we use, and last but not least, food, nutrition, and how that plays a role.
So what are some people need to be looking at if they maybe think they have Alzheimer's? What are some, things that you start to notice in yourself?
Well, I like what you said in the beginning. Alzheimer's is just a form of dementia. In other words, there's different forms of dementia. So the important thing is, if you feel that you may have that, or a family or friend member, is to make sure you go to a specialist, someone like a neurologist, neuropsychiatrist. There's certain protocols that need to be taken when in assessing someone. And make sure that the person has gone through all these different protocols or tests, basic tests, which are just question and answer tests. And then last but not least, if there's really suspicion of the disease, you can go through an exam called a PET scan. And that's an exam where they actually scan your brain to see if you actually have these plaques. And
you have an event coming on? Or
yeah, we have an event. It's called A Long Goodbye. That's the title of our topic, which will be held tomorrow at the McAllen Public Library at 10 a.m. And we'll try to encompass and cover just about everything you can, especially within the first part of the talk, to talk everything you can and know everything you can about Alzheimer's.
And is everybody welcome to come, or?
The whole community is welcome. The second part of the second, that's probably the most important part of the talk, is how we can reduce our risk for Alzheimer's.
And what is the number that people can call, or where can they go to find out more about your event coming
They can go to my local website, drfredromero.com, or call at 956-668-7246.
There you go, people. You guys have the number to call and find out. So it sounds like a very interesting topic. So don't forget to check it out to be a little bit more informed about Alzheimer's. But don't go anywhere, because when we come back, we have all you need to know in your entertainment news. We'll see you in just a bit.